up to 2 to 3 adult patients at a time. In the OT department, we're mainly pediatrics.
Okay.
So we stick a lot in this area.
All right.
This area that I'm about to show you. This is our pediatric gym area.
Okay.
We have the mat that we needed the tables to work on, and then around the corner there's 2 codas that
Okay.
work under me, and they treat patients as well in this back area. But
Oh, okay.
we just some patients need, I guess their environment needs to be smaller. It needs to be more contained versus a larger open environment where kids can be running and playing, and so that way we minimize distractions and get them more focused to what we're trying to achieve.
Right. Okay. So I guess what? Hi, I'm Sarah.
I was talking to her.
Oh, miss. Oh, wrong person. I'm sorry. So you're an occupational therapist,
Yes,
right?
I'm an occupational therapist.
What did you have to do to get there? Like, what were the requirements for your job?
Okay, the requirements, we had a lot of, me personally, the program itself that I applied to had requirements that were biology, chemistry, and psychology. I ended up getting a major in biology.
So you did the 4-year degree?
4-year degree,
Okay.
major in biology, minor in psychology.
Psychology.
I knew what I wanted to do, so I had a feel for what I wanted to accomplish in regards to being prepared for certain programs that were out there.
Okay.
Upon completion of the 4-year degree, I applied to the program. I got into my master's program, and then from then on, it was a 2.5-year program plus maybe another half year of clinical rotations.
Okay. So your daily routine, you work in these areas that you're at, or do you do more of like the emotional or psychosocial, whatever?
No, I mean, we do, our treatment consists of, in regards to OT, we do have our main areas that we look at, which are a lot of the fine motor coordination, gross motor skills, motor planning, psychosocial issues, like in regards to social skills and how their behaviors and so forth. But really in I guess the majority of what we see here in outpatient, they kind of have limited us to us needing to be, or the patients that we see needing to be deficient in regards to activities of daily living, which they want to know more of the basic ADLs, which consist of like bathing, grooming, self-feeding, toileting, dressing. So as long as they're presenting with deficiencies in those areas, we're okay, I think, at this point to where we see those kids here in the outpatient.
So they have to have like deficiencies, like they're not operating well in that, or they are?
They're not
operating well.
And then that's what it is. Is for some reason they have certain impairments or a condition that's keeping them from performing independently in regards to those areas that I listed to you. And then again, we do look, like I said, at the fine motor skills, the gross motor skills that can go over to how the kids in regards to like maybe handwriting, also in regards to purposeful play and so forth. But that's a lot of what we see here in the clinic. Again, I think in regards to insurances, they've limited us to what we can see more or less, because a lot, like if we put handwriting goals, sometimes we get denied on cases like that, and they kind of say no, leave that up to the school system.
Right.
So we kind of got a feel for what goals we need to be addressing, and we go from there in this outpatient.
So a lot of kids from the school system come here?
Not really. I mean, I would. There are some kids that get services or help in the schools, and that they also get additional help here in an outpatient setting. But not necessarily. We do see kids that aren't getting help in the school that we end up seeing here in the outpatient clinic.
Right. Okay. So does a patient have to have a doctor referral in order to be able to come here?
Yes. They do need a doctor's referral. He's the one that ends up sending them, and then we go from there.
Right.
We do the initial evaluation, and an occupational therapist needs to handle that. The initial evaluation starts, and they end up creating the plan of care that later on assistants end up that basically that everyone tends to follow in regards to the specific needs for that particular child.
Right.
So and after that, then assistants can also see the children for treatment.
Right.
Okay.
Okay. This is really cool. Were you here when they did these?
No, actually, I wasn't here. When I came on board, this was already done. But the person that actually she ended up painting all of this. She used to work here in the past. For a time, she left, and she actually came back recently. Her name's Vic. She's a physical therapist.
Okay.
That we actually passed by at the front. She ended up painting all of this herself.
Okay.
So that's pretty neat.
Awesome.
Yeah.
So let me ask this because I
Uh-huh.
get confused sometimes.
Mhm.
What's the difference between an OT and a PT?
Okay, well, physical therapy, what they look for, I really, can't dive too much in there, but they look for a lot of the physical movement.
The physical.
The gait, they look at gait and how the child's walking, running,
Okay.
and so forth. In regards to OT, we look at a lot of ADLs, activities of daily living. And
Okay.
Now, I leave it like that because, again, it can be in regards to basic ADLs or
Right.
what they call instrumental ADLs as well.
Right.
And what a child does in a daily basis, we kind of as therapists or as OTs encompass quite a bit when we say activities of daily living of a
It's
child.
quite a bit.
Yeah, it's quite a bit.
Yeah.
Anything from purposeful play to handwriting to because their daily routine consists of writing at school. So can
Right.
they do certain things? Can they dress themselves? Can they feed themselves, which
Yeah.
are things that we kind of take for granted
Yes.
until either an injury happens or some kind of condition occurs
Where they
that
can't do it anymore.
where they can't do it anymore. So we
Right.
help out and we come and try and rehabilitate the individual
Right.
to get to that independent level.
Do you work a lot with the PTs? Like, do all the groups work together, or is it just like your own individual section and their own individual
No,
section?
we do work a lot together, especially for the kids that end up getting multiple disciplines. We try and just keep, I think, keep communication open, but we want, of course, the most effective and the most beneficial treatment for the individual that we're seeing. So we want to make sure that we are on the same page, that we, across the board, we know what's going on with that particular child. Because it could be one thing that one person knows that could affect all three disciplines, and we just all want to be on the same page. So we do have a lot of, we try and have monthly case conferences that kind of keep us in line with certain patients, so that way we know we're
Right.
giving the
And this is with
appropriate-
each other, right?
Yeah, this is with each other, but at the same time, we do give feedback to the doctors when we need to.
Right.
So in regards to certain clients and what we end up encountering down the line of a 6-month time span.
Okay. What's it like? I guess, what's some of the most challenging parts of being an occupational therapist?
I guess just trying to figure out, since everything's case specific with each individual child, it's just trying to figure out, what kind of, I guess, tact to use in regards to
Right.
how you're going to approach the child, or what are they, maybe they're used to something within the confines of their home environment only, and so it's now, they come to this facility, it's something, totally different from their usual routine. So
Yeah.
I think it's just kind of building the rapport. I would have to say, I guess, kind of to keep it very simple, building that
Okay.
rapport with the child, and then from there trying to make sure you're addressing the specific needs and the deficiencies that the occupational therapist noted on the evaluation.
Okay. I guess I'll kind of wrap up with this. Thank you so much for last minute interviews.
Yes,
And
no
it's,
problem.
I know it's kind of crazy schedules, and thank you.
Yeah, no, you're
So my
welcome.
last question will be, do you have any advice for people who want to be an OTA or an OT? Like,
Okay.
just,
I think just really and honestly, I can say study hard. Just make sure you have a passion for what you decide to do in the future. If you want to help rehabilitate kids in a setting such as this, make sure you are choosing the appropriate profession to do what you love to do. When
Yes.
you love what you're doing, it shows down the line. You can do that job for many years, and in the end of it all, before you end up retiring, that you did something worthwhile for not only yourself but the kids that you end up treating or the adults as well, because you can be in a setting like that. So just find passion in what you do and just go for it and study hard, and
Okay.
that's as much advice as I can give.
Okay. Thank
All
you
right.